If I went back in time and asked my grandmother about breastfeeding, she wouldn't know anything about what we know today. All she would know is it's important to keep the baby alive. That's the food for the baby. That's all they knew.
Yeah.
But we've had so much scientific advancement and we understand how important breastfeeding is. And it's not just about the nutritional value, it's about emotional value as well, for both the baby and the mom. So I think we tend to forget a few important principles in life, but breastfeeding is so important for babies to have a good start in life. If it's a good thing, I would say even if we have 99%, there's always 1% chance to improve and reach 100%. So there's always room for improvement. But I would start with UK statistics. I think it's roughly about 15 to 17% of babies continue to breastfeed at the end of 3 months.
Right, okay.
And at the end of 4 months, there is a slight fall to about 12 to 13%. But if you look at the numbers, how many mothers actually start breastfeeding, it's a decent number, 74, 75% nearly.
Okay.
But then because of various reasons, it falls down to 15 to 17 by the end of 3 months.
It's not easy for everyone though, is it?
I think if it was so easy, we wouldn't be talking about it so much. So we keep talking about it because it is something tricky and difficult. I have no idea how our ancestors in previous generations just managed it. But there were plenty of other things which used to be in their practice, because if mom can't breastfeed because she was unwell, the auntie would breastfeed the same baby, or the grandmother would breastfeed the same baby, because the grandmother sometimes has so many children. The first child is having a child and the grandmother is having her last child. So it was very interesting in those times. Many women used to breastfeed these babies, whereas now it has to be the mom and mom alone. So that is where the problem comes. So yes, it is tricky, but we have policies and procedures in place to make things easy for families and these moms and babies. So I think we should promote it.
If we go with the health benefits of breastfeeding, what are the health benefits for the baby? Because obviously it's the nutritional benefits are most important, I'm guessing.
Yeah, there are plenty of benefits, both for the mom and the baby and for the whole family.
Okay.
So if you talk about just the baby's benefits, I would say these babies tend to have decent immunity because they are getting all the good value, immunological value from the breast milk.
Yeah.
So they have less infections, especially tummy bugs. We call it gastroenteritis.
Right,
which is diarrhea and vomiting. We call it DNV illnesses. So they have much lesser incidence of diarrhea and vomiting, which indirectly tells us that they need to go into hospital fewer number of times. Because if you have more diarrhea, you're going to end up in hospital as a baby.
I was going to say, that must be very serious then you mentioned babies before of kind of 3-4 months old. At that age, if you...
It can be life-threatening, and in many parts of the world, it is still a life-threatening disorder where babies die because of diarrhea. So it's not a common thing here, luckily.
Yeah, okay.
But at the same time, we need to be aware of it. And yes, as you said, the nutritional value, it is just exceptional.
Yeah.
There is no alternative in terms of nutritional value to breast milk. And it's been really shown by research that because their immunity improves, they have less allergies, food allergies, other respiratory allergies, they have less eczema, skin problems, and they have less asthma. So universally, it's good news if we can get the babies to breastfeed. And when we talk about mums' benefits, I think one of the most important things is the emotional bonding that the mum gets when she breastfeeds the baby. We don't understand how much emotional bonding baby gets from the mom's side. That I think will take a few more years of research for us to understand. But I think it really is important for both mums' emotional well-being as well. It's clearly shown these mums have less incidence of mood disorders, low mood or depression. So definitely there's a better number there to look at.
Okay, and I understand that particularly for babies who are born early, skin-to-skin contact is very important.
Yes.
And I mean, there can be no closer skin-to-skin bonding, I'm guessing, than breastfeeding your baby.
Absolutely. I think what we do nowadays is we put them straight on, skin to skin and start breastfeeding within the hour.
Right.
That is the golden standard. Sometimes because of various medical reasons that may not happen, but the midwives at the hospital and the neonatal nurse, they are brilliant. They understand this so well, and they put these babies skin to skin straight away.
Okay, I mean, in terms of babies who are born early then, I'm guessing, is that an extra challenge for breastfeeding?
It will be, because two reasons. One, babies may not have learned how to suck properly.
Okay.
Because they are so young when they come out.
Yeah.
They may not have learnt that sucking yet. And the second thing is, mum may not be well enough, and then baby has to be taken away from mum to the baby unit. So there is a separation there, which can cause a little bit of an emotional issue there. So in those scenarios, what we do is we ask the mum to start expressing quite early, so that when the baby is ready to have the breast milk, the milk is ready. And I think that's where ppbf also comes into the picture.
Yeah. With Seb, actually, when he was premature, about 4 weeks premature, and he got taken away really quickly, and my milk didn't actually come in, so that was another reason. But they have to get the most important bit out, which is the colostrum, which they did with a syringe, and then we started breastfeeding them. But my milk didn't come in, so it was really frustrating. We tried to express for a couple of weeks. But then that bit is the bit I think sometimes we give up too easily, I have to be honest, and I didn't carry on with breastfeeding, but I think hearing from what doctor says is so important to keep going.
We were talking about the emotional benefits then, when you have a premature baby, there must be so many additional emotional challenges for the mother.
Yeah.
That actually, if breastfeeding can help with that bonding, I'm guessing
it definitely helps.
Yeah.
And like I did, we did as much as we could. Even the nurses, they would say, "You can't get any milk." We just couldn't get any milk out of mine. I don't know what was wrong with them. That just a millimetre was enough that day anyway, so we were good because he was fed through a syringe, 1 millimetre every hour or whatever. So, whatever I could get out helped.
That again must be quite common though for some women. Some women just find it difficult and it doesn't work. So it's not about shaming those women.
Absolutely
everyone's got a unique journey.
No.
It's just working out what's best for you and your baby.
Yes, I think it is.
I think these tend to be discussed quite early in pregnancy with the midwifery staff and the obstetric team as well.
Yeah.
So, and they put plans in place to see how best to help these moms.
Yeah, okay. So, I mean, again, here actually, one of the notes we've got here is about breastfeeding guilt as well and how mothers can experience that. I'm guessing there's the guilt if you can't,
definitely,
for any reason, or the guilt if you can't provide enough, or, there's so many aspects of guilt. But again, it's working with the medical support to work out what's best for you and the baby.
So what we do is we think about why this mum can't breastfeed. What is stopping this mum from breastfeeding, and we tease these statements out into smaller fragments so it's easy to understand. And there are some conditions where we ask the mum not to breastfeed.
Okay.
So these are exceptionally rare.
Yeah.
But there are medical conditions and infections in mum which may be better not to breastfeed the baby at that point. So, and this is not a single person's decision. This is a whole team which is involved in making this decision. Although it's exceptionally rare, there are some conditions where we do that. But there are conditions where sometimes breastfeeding just fails, for various reasons. I can give you a few examples.
Yes, please,
As we spoke earlier, preterm babies. Because preterm babies get taken away to the unit, sometimes mums, although they may want to do it, sometimes it's just their body doesn't, they just can't breastfeed or express enough milk, because there's nothing like a baby actually sucking on the breast.
Yeah.
How many other machines you use to express? It's the baby sucking, which will make some hormonal changes in the mum, and then they can produce enough breast milk. So if that doesn't happen early, sometimes it may not happen. So in that scenario, we do tend to have problems. But there are other issues where babies can't suck properly because of a neurological disorder,
Yep.
a brain problem, and sometimes you probably have heard the term cleft palate,
Yes. Yeah.
where the roof of the mouth is open instead of being closed. It is
Yeah.
a developmental problem, and those babies can't suck properly. Whether it is the bottle or the breast, they have problems creating a suction.
And is that something that's quite common in premature babies?
Not in premature
Okay.
babies. It is seen in any baby.
Okay.
But we do have teams to sort those problems out.
Okay.
They tend to go away to UK for surgeries. And one of the other important ones is a tongue tie. You know, if baby
Yes.
has a tongue tie, then once again they can't breastfeed properly. So it's about identifying where the problem lies and then dealing with that problem. Sometimes it takes a little bit longer, but sometimes it's just us being aware of what the problem could be.
Okay. You mentioned there as well when premature babies or babies who for whatever reason need to go over to the UK for treatment, that must then have an impact on the breastfeeding bond as well?
Yeah, any separation, where even for a few hours, it causes a problem with both mom and baby being separated, and the emotional bonding is disrupted there. So yes, there are some babies who tend to become unwell for
Yeah.
various reasons, and then we send them to UK by, let's say, helicopter or flight, and then sometimes mom and dad can go with them, but sometimes the mom has to go later
Okay.
because either there's no space on the flight or the mom is so unwell that she can't be
Yes.
put on a flight.
Yeah.
You know, various logistical reasons as well. In those situations, that separation causes some problem.
Okay.
But one of the other advantages in the UK is there are breast milk banks there.
Right. Okay.
So which we don't have on the island, because I mean we are a small island, and it is a huge investment to make for very small number of babies. So if these babies tend to go to UK, the donated breast milk that
Yeah.
can be used in those babies, which
Okay.
is really good.
But when the mother is able to travel with the baby, obviously with the Priaulx Premature Baby Foundation's flats,
Yeah.
which are right at the hospital, that must help with the bonding because the mother is so close to where the baby is.
And we've also supplied some electric breast pumps,
Yes, okay.
which were top of the range, because from my day, which I can't even explain what they were like, were like
Yeah.
milked by a cow, but
Okay.
now it's really
Okay.
top things now, and it's electric, so much easier and much quicker. So yeah, we've got those in the flat, so that helps. And yeah, there is that fact that they are close and they can be together. I think in my case, anxiety doesn't help. And,
Yes.
You know, I had to leave Seb every night, leaving him in the hospital and drive away for 8-9 hours. But yeah, that just didn't help. And now when I hear what Dr. Scott say, you can see how many factors can actually
Yeah.
stop you from breastfeeding. Just my milk just wouldn't come in.
Yeah, I mean, anxiety, stress,
Yeah.
and just being
Shock
worried,
as well,
and yeah,
having
in
a
shock,
baby.
all those things will impact on
Absolutely.
the
Yeah.
woman's milk supply and her
True.
ability to breastfeed.
There are some good things that we didn't speak about as well.
Okay.
Because these mums, it's been clearly shown that it helps in weight loss in the mum after the
Oh, we
childbirth.
need that.
There we go, yeah.
One of the really important things that mums would consider, although people think, oh, it actually doesn't help in weight loss,
Yeah.
it's on the contrary, it does help with
Wow,
weight
okay.
loss. And there's clear evidence that these mums who
Mm-hmm.
breastfeed their babies have lower incidence of breast cancer in future.
Right.
So that is one of the long-term benefits
Okay.
in the mum. And if you think about the short-term benefits, soon after the baby is born, mums lose less blood
Yeah.
after the baby is born because there is one particular hormone called oxytocin which comes from the brain into the bloodstream, which helps in two things. One, to get the milk out.
Yeah.
Two, to contract the uterus, to make it shrink.
Yes. Okay.
So in two ways, this particular hormone really helps. So their uterus, the pregnant uterus after the childbirth needs to get back into the pre-pregnant size.
Yeah.
And this hormone plays a huge role in that.
And so that comes back to then, as you said, you know, trying to encourage breastfeeding as soon after birth.
As soon after birth
Yeah.
as possible, yeah. So there are short-term benefits and long-term benefits which we need to keep in mind.
Yeah, and there is help available, isn't there, for women who are, you know, expecting a baby or when they've just had their baby. There's help through the hospital, as you said, the neonatal staff
Plenty.
can offer advice to kind of get started on this journey.
It starts off from the midwifery team, the obstetric team, the neonatal nurses, the health visiting team. There are plenty of community teams which help.
Yeah.
So we just don't hear about these because it's all happening, and we don't talk about them. But there's so much activity and so much help around. It's just that these mums need to know who to contact and how to get this help.
If someone really can't, Jo, as you said with Seb, you really struggled and you couldn't. What are the alternatives? Presumably, it's a formula milk. Very early babies, I'm guessing, are tube fed.
They are
syringed.
Yeah,
wow. Okay.
By 1 minute.
And were you able to feed him in that sense?
Medical staff, and they were just. I used to watch though. I think it sort of got quite quickly, but they have to start off quite small amounts.
I think it's really important to understand that we are at an age where we don't want to put too much pressure on the mums, because that's going to cause emotional issues. Because she's going, as you said, they're going to get that guilty feeling that they can't breastfeed. I think we should avoid doing that. So formula milks are very safe. In many medical conditions, we tend to depend on these formula milks when we are still waiting for mom to produce enough milk. Because the babies can't wait for that, so we have to keep them safe, and we need to give them enough calories as well. So we depend on formula milks. We depend on intravenous drips to keep them going with the glucose. And as Jo says, if these babies can't bottle feed yet, their sucking is not so good. Then we put a little tube down the nose and then give them the express breast milk from the mum through these tubes if the baby can't. So even though the baby is not sucking on the breast, they are getting the value, the nutritional value of the breast milk from the tube feeding. There are plenty of groups around to help these breastfeeding mums, because we don't want them to be out there without any help. So there are groups such as Bosom Buddies, where they do apparently an excellent job. I haven't been there, but I'd like to go and visit them and see what kind of good work they're doing really. And as you said, there are plenty of employers now who have adapted their workplace so that they provide a safe space for mums to actually express. And in some instances, they've gone above and beyond, and they've even created a space where mum can breastfeed instead of just expressing. So there are some really good employers doing that, but as you say, we need to be more aware of these, and we need to improve these practices.
For women, not just with premature babies, but with babies who are poorly for any reason, isn't it? And you mentioned about the breast pumps at flats in Southampton.
And one at the hospital as well. Baby boxes, we make sure we've got the right bottles. We also got nipple shields, and we've got like a cover they want to breastfeed. So we've got like a bag for cooling so they can express the milk and put it in the fridge. So we're trying to promote it. But after this talk, I think really we should look at some new avenues actually.
As you said though, bags for keeping the milk cool and things like that. There's so many tools to help now.
Yes, absolutely, because these bottles, some of these bottles, they may not be the best design, and they can cause more air swallowing. You know, babies can take in more air than necessary, and they can cause a little bit of colic. But you know, with breastfeeding, that doesn't happen. If the breastfeeding is really well, if babies can do it really well, then colic, I don't think happens much in breastfed babies.
That is interesting. I mean, if people have got any questions then, who do they ask? You mentioned Bosom Buddies, so that's a charity locally.
And the community midwifery team,
they can offer.
The health visitors, they can signpost these mums and families to the right place. I think it's all about giving these mums and families the choices of feeding options. It's not about us asking them to, ordering them to do this or that or, something else. It's about giving them options and then let them decide what they want to do.
Or let baby decide, because actually even if the mother is willing and able to breastfeed, it might be that for some reason the baby can't.
Yeah.
So it's about ensuring that the baby is getting the nutrition.
Absolutely. In those cases, I think expressing the breast milk is the best option.
Yeah.
Yeah.
We've had so much technological advancement in
definitely.
these so many decades.
Yeah.
But the one thing which we have never been able to artificially make is breast milk. You just can't
True.
make it.
Yeah.
Everything is artificial intelligence powered, AI powered now, but you just can't
Yeah.
make breast milk.
You can't.
So yes, you can rely on these formula feeds, but nothing like breast milk. And when I was looking at the acronym PPBF,
Yeah.
I was just thinking I was going to tell Jo today, can we use this PPBF for a week, saying please breastfeed?
Ah, yes.
I like that. Let's do that for the week.
Yeah, that's
I
a
like
great
that
idea. And because it's just about encouragement, isn't
It
it?
really is. It's a personal choice, but encouragement would really help. I mean, I think now if I could go back 20 years, I would really, really try
Yeah.
and keep going because
But obviously at that time Seb was still in the hospital.
he was.
So that must make it so difficult for
I wasn't there at the right time. And I had to wait to see him till the next morning. But yes, you can express and do everything else. But I think now if I had my chance back again, I would really give it a
Yeah.
big shot.
So it's about encouragement. So please breastfeed.
I like that.
And speak to the midwives and the health visitors. They can do the signposting.
Some of these principles have changed. We have learned more about these things
Yeah.
in the last few years, and some of the myths have been broken. So I think it's more important for us to understand that by one way or another, we need to get this baby some breast milk. We don't need to be rigid in our practices saying, oh, we need to breastfeed this baby. Even if the mom gets a tiny bit, that is still useful. And there is a myth that, oh, these babies should be breastfed for 6 months. Yes, the World Health Organization says breastfeed these babies exclusively for 6 months, but doesn't say you should stop there. So I don't think we need to stop at 6 months. We can continue for a good few years.
Thank you for listening to The Interview, a Bailiwick Express podcast. If you liked what you heard, please like and subscribe. You can find us on all social media channels, and if you'd like to keep up to date on all the work the Express team does, please sign up to our daily email by visiting gsy.bailiwickexpress.com.